The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, how chelation works to improve your circulation. Your presenter, Ron Hunninghake, MD.
Thank you very much. I'm very pleased to see a good group of you here today. I'm just curious, how many of you have either had chelation or have someone that you know pretty closely that's had chelation? Okay, so quite a bit of experience with it. Well, by the time I'm done, I hope that all of you will have a real familiar sense of what chelation is, because chelation is not complicated. It's a very simple idea of how to improve your health and how to improve your circulation. And so by the time we're done, I'm going to try to get that idea across to you. Now, I want to point out one interesting thing is that we humans have two brains. Sometimes my wife thinks I don't have quite that many, but we have a left brain and a right brain, and they function a little bit differently. The right brain is more holistic. It kind of sees the whole picture. It's very practical, kind of is very visual. The left brain is very scientific, analytic, kind of wants to see the evidence, the details, the facts. The right brain is kind of getting the overview, the big picture. And what I'm going to be talking to you about today is how I think there really is two views of chelation. There's a right brain view which looks at the practical value of chelation and what it does for people. And then there's the left-hand scientific view which says, okay, where's the evidence that chelation really does work to help people? And hopefully, when we're done today, there'll be a kind of joining the corpus callosum of the presentation, which is that's the structure that joins the two brains together. And so with that kind of little introduction, let's kind of jump in here and talk a little bit about chelation. Chelation is a medical/lifestyle therapy to improve general circulation. And I'm going to explain the components of this definition. It is a medical therapy. There is such a thing as oral chelation. I'll talk a little bit about that at the end. Today we're going to be focusing on intravenous chelation, where you get the chelate IV, but it's also done as part of a general lifestyle. It's not just in and of itself getting the IV. It's also what you do to take better care of yourself. And then we're going to see how it improves your circulation and why that is a fundamental component of how chelation helps people feel better, function better, and very often improve the illnesses that they're dealing with. So if we stop and think about what is good circulation, it has to do with your arteries. These are the little tubes that allow blood to flow to all your organs. And when they are injured, they don't function as well. What are some things that can injure your arteries? We don't see our arteries, so we don't think about them being injured. Homocysteine, or as Dr. Jackson would say, homocysteine, is the molecule. Yes, is the molecule that is produced if you do not have enough of some special B vitamins. It's a breakdown product of methionine, and the American diet is very rich in an amino acid called methionine. And if you don't break it down properly, you'll have a buildup of this toxic substance called homocysteine, and it will injure the lining of your arteries. Bacterial infections can injure the lining of your arteries. We now know that people who have chronic gingivitis, they're more prone to coronary artery disease, because the thought is that bacteria is leaking into your circulation and the bacteria are causing damage to your blood vessels. This last item here, hemodynamic stress. Your heart beats 100,000 times a day. How many of us have thanked our heart for all the work that it's done for us throughout our lives? But 100,000 times a day, every time the heart beats, the first set of arteries that get the stress of the heart beating, where the arteries are expanding, are the carotid arteries and the coronary arteries. Well, what are the main killers here in the United States? It's heart disease, the coronary arteries, and stroke, carotid arteries, and the cerebral arteries. And so this hemodynamic stretching and stress and little tears that it causes in the arteries, these can be the source of the beginning of an inflammatory process that does damage to your arteries. So when those little tears occur, it's just like as if you got cut or injured on your skin. There's going to be an inflammatory response. The white blood cells are going to come in. The repair cells are going to come in. And if they have the right nutrients and cofactors to do the repair, everything is fine. But if they don't, that inflammation will trigger a whole series of problems. And one of the things that happens is you'll have a buildup of free radicals in the area of the injury site that causes cross-linkages, which will make the arteries more stiff. So you'll start to get a buildup, a plaque buildup, a stiffening, and the arteries are not working so good. They're also becoming narrower. You're not getting enough blood through. That's why when people go in and have their arteries checked, very often they'll have to have stents put in order to open up the areas that have become narrowed. And the very worst thing that can happen is if the inflammation in this plaque buildup reaches a certain peak, the plaque can actually rupture. That will then trigger the formation of a blood clot, which will block off the blood flow either to your heart or to your brain, and you will have a heart attack or a stroke. So this can be very severe consequences, and the general name for this is atherosclerotic vascular disease. Now that's just in terms of your heart. It can affect other organs as well, but these are the more dramatic forms of vascular disease and artery problems. So how would chelation help in preventing or treating this condition or this sequence of events that probably has happened maybe over 5, 10, 20, 30 years? Because we know that heart disease doesn't just develop overnight. It's a very slow process. It's happening in a place where we can't visualize it. And oftentimes the very first sign of heart disease is sudden death. So what we're really interested in is what we can do to change our risk for this sequence of events. And this is where chelation comes in. And I'm going to define, this is, if you can kind of take this home with you as the simplest idea of what chelation is. Chele is a Greek word for claw of the crab. And the molecules that we use to do chelation actually look like a claw. And they grab a hold of metals and pull them out through your urine. Chelation grabs and removes heavy metals from the walls of your arteries. These tend to be what's called divalent metals: calcium, cadmium, aluminum, copper, iron, lead, zinc, and manganese. Now you'll notice that there are some good minerals in there. The cadmium, the lead, the aluminum, these tend to be what we already know are toxic or heavy metals. Copper can be a little bit of a double-edged sword. Iron, which we absolutely have to have, it can also create problems. Calcium is what tends to build up in the plaque itself. And one of the earliest ideas of chelation is that by pulling out the calcium, you would kind of like pull the rivets out of what held the plaque together, and it would just dissolve. And we now know that's an oversimplified idea of what chelation does. But it does pull out some good minerals like zinc and manganese, and that's why it's very important that if you're doing chelation therapy, your chelating doctor needs to make sure you're taking supplemental minerals in the form of special multivitamins to help you replace what you lose in response to chelation. So just as I mentioned, this idea that the chelation decalcifies the blood vessels, we don't know for sure that's what's happening. We have reports of some people who will have big plaques filling up their carotid arteries or their coronary arteries, and after so many chelations, those plaques will have diminished. But we think that the benefits of chelation happen on several different fronts, and that this is maybe an oversimplified explanation for the benefits of chelation. Probably the one explanation that's the best justified by the science that we have is that chelation reduces oxidative stress. The copper and the iron are, and some of these other heavy metals actually generate free radicals, peroxide radicals, which can cause oxidative damage and which keep the inflammation at the vascular level going. It becomes self-perpetuating. And it's much like if you've injured cartilage in your knee. Just the injury itself will start a sequence of events to where over time you'll develop arthritis in that knee. Once the artery has been damaged, if you don't remove the factors that are perpetuating the inflammatory response, it will continue to occur and grow, and that's really a definition of what coronary artery disease is. It's the very slow, gradual, and progressive development of plaque in there, and the question is, what's causing it? And one of the answers is the buildup of heavy metals in the arteries. And you say, well, wait a minute, I'm not exposed to heavy metals. Oh, yes, you are. There's metals in the air that we breathe, in the water that we drink. If you live in an older home, some of the pipes are still coated with lead. There are some of the older drinking fountains are sources of lead. Your toys, the big toy recall, there's lead in the paint. So there's a lot of ways that you can pick up free radical inducing metals and not even know it. Coffee machines use aluminum coils, and you may be picking up aluminum from your coffee, for instance, as an example of that. Certain cookware contains aluminum. Another major cause of what we think causes artery disease is endothelial inflammation. If you've got an excess of iron in your system, that will trigger the formation of something called NF-kappa B. It's a cellular cytokine. It's a messenger molecule that tells the inflammatory system to turn on, to activate. And too much iron will overly activate the inflammatory system. And if you wonder, well, how does this translate into artery disease? If you go to your nursing home, who do you mostly see there, men or women? Women, because women tend to outlive men by as much as 8 or 9 years in our culture. One of the theories, now there's a lot of theories as to why this is the case, but one of the theories is that women continue to have periods through most of their adult life, and the menstrual blood flow keeps their iron from building up to excessive amounts. So the other group of men who have a little bit better cardiovascular outcome are the blood donors. If you are one of those 1 gallon, 2 gallon blood donors, you're going to reduce your risk of heart attack by reducing your iron reserves, and that may cut down on the inflammation in your arteries. Well, chelation also pulls out some of the excessive iron that may have otherwise built up in your arteries. So if we look at what happens as a result of chelation, the thing that's been most dramatic to me, I've been here at the center for about 19 years now, and I've been doing chelation with patients for most of that time. And if we have a patient coming in with heart symptoms, angina, and they start doing chelation, they will notice that the amount of heart symptoms that they're having, specifically chest pain, will begin to reduce. And we think that's because as you remove the heavy metals from the walls of the arteries, the cross-linking is reduced and the arteries become more pliable and they open up a little bit more. Chelated arteries are able to open up and allow more blood flow to vital organs. That then reduces the angina chest pain. Now, I've got in your packet here a kind of a beige or off-white paper. And on one side, there is a list of the studies that have shown the amount of clinical improvement in studies that have been going on throughout many, many years. And you can look at, like that first study was by Dr. Clark in 1955. He did another one in 1956. But in general, what you'll notice is most of the studies have a fairly small sample size, and a lot of what was being measured was clinical improvement. But if you look at the amount of clinical improvement there, almost everyone that has done the chelation has noticed that they improve clinically. These are what's called case studies or case series studies, and this has been the basis of much of the research on chelation. And from a right brain perspective, if people go in and have a procedure, and a number of people have that procedure, and they get better, they have fewer symptoms, our right brain says, hey, they're better. This chelation is helping them. And that has been the general observation. That's been my observation. People that come in and have chelation, clinically, they improve. There's been over 1 million chelation, there's been 20 million chelations done in the world since the advent of chelation. Over 1 million people have experienced chelation. It's proven itself to be very safe. And the vast majority of people who do chelation notice improvement. But again, that's a right brain observation. The scientists say, well, wait a minute, we want harder evidence than that. But I did want to show you, for all the right brain people in the audience, there is a basis for why chelation has enjoyed the success that it has. People do improve when they have chelation. How do we do chelation? It's an IV procedure. We put an IV in a person because only about 5% of EDTA that you take by mouth is absorbed across the gut. That's why oral chelation has generally been poo-pooed by most of the chelation experts. Though, if I get to it at the end, there is a new theory that perhaps oral chelation may be of benefit, not because it's going into your bloodstream, but because your liver may be filtering some of these heavy metals out, dumping them in the bile, and the EDTA that you've taken by mouth is chelating the metals in your digestive system and pulling them out with the stool instead of allowing them to be reabsorbed and recirculated back up to your liver. So that may be a basis for the benefits of oral chelation. But today we're talking about IV chelation. EDTA is a man-made amino acid, and it's generally infused with magnesium, vitamin C, some B vitamins, and sometimes procaine, which is kind of a numbing medicine. IV chelation is usually given weekly for at least 20 to 30 weeks, and sometimes longer. We have patients that have had over 200 or 300 chelations. They've had so much benefit from it. The amount of chelation that you're going to require is going to be very variable depending upon how long you've had your illness, how severe it is, how much buildup of heavy metals you've developed over the course of your life. I've got a picture here of a patient receiving chelation. It's really a pretty simple procedure. It's important for the nursing staff to know what they're doing, to use the proper calculating formula. We have a computerized formula that we use to calculate the right dose of the EDTA. We use the standard protocol, a national protocol that's been established for mixing the various ingredients of chelation. But when you get right down to it, chelation is a person sitting in a chair receiving the EDTA and the vitamins and the vitamin C through their vein over about a 3-hour period of time. If you use the standard EDTA, there's two forms of EDTA. There's disodium EDTA and then there's a calcium EDTA. Traditional chelation has been done with the disodium EDTA because it tends to bind calcium better than calcium EDTA. Calcium EDTA, however, does pull out lead and other heavy metals. And so the benefit of calcium EDTA is it doesn't burn or sting. So you can give it faster, you can give it in different types of formulas, whereas the traditional chelation formula is disodium EDTA. That's getting a little bit technical. So ethylene diamine tetraacetic acid is what EDTA is. It was first patented in 1938 as an antidote to the chemical warfare agents that were being invented just prior, or as a result of World War I. It has a very similar chemical structure to amino acids, and what it does is it binds heavy metals and divalent ions. The ones that we're generally interested in are the lead, cadmium, aluminum. Some people come for us for chelation because they say, I'd like to get the mercury out. But EDTA is not a very good mercury chelator. It has a very weak binding coefficient to mercury. However, it is beneficial for people that have mercury toxicity to remove the other heavy metals because lead, cadmium, and aluminum will make mercury toxicity worse. So it's still worth your while to do EDTA chelation even if you are primarily wanting to get out mercury. And then once it binds, once the EDTA grabs a hold of, the claw grabs a hold of the metal, that makes the metal more water soluble. It gets into your bloodstream, and then the kidneys excrete it. And we can actually measure the amount of metals coming out in your urine, and we do. That's one of the ways that we determine who is a good candidate for chelation therapy. Now, lest any of you be afraid of EDTA, EDTA is a common ingredient in mayonnaise and a number of other regular foods. The chelating agents act as preservatives. And so there is EDTA in mayonnaise, and so for those of you who have been eating mayonnaise, you've been chelating and didn't even know it. The bottles of EDTA come in they're given by prescription. The physician writes the prescription for the patient. The nurses calculate the dose, and the patient is given the EDTA just like any other medical treatment. A little bit more about how chelation improves circulation. This is a little bit of a review. The heavy metals catalyze free radical formation. These free radicals can also oxidize cholesterol, and one of the things we're finding out is that it's not just cholesterol that's the bad guy, it's oxidized cholesterol that builds up in the wall of blood vessels, and that tends to cause more damage and inflammation. That damage then becomes the basis of the development of plaque. Plaque clogs the arteries and puts you at risk of a sudden rupture, which can cause a heart attack or a stroke. What chelation does, basically you just are removing the metals. You're removing the damaging metals. There are some people that question me and say, well, doctor, do you know for sure that chelation is a treatment for heart disease? And I'll say, no, I do not know that for sure, but what I do know for sure is that chelation removes heavy metals, and I do know for sure that heavy metals are toxic to your system. They are protoplasmic toxins, and that in our culture you can have a burden of these toxins. Welders, for example, seem to be more prone to heart disease because of a buildup of cadmium and other heavy metals in their system. They're exposed. And so I always am very careful to take a history of the patient. What kind of occupations have you been in? What kind of homes have you lived in? Could you have had exposure in any special place? And I don't always find that out, but when we do the first chelation, we check their urine for 24 hours to measure how much of these heavy metals are normally coming out. We do the first chelation, and then we have them collect their urine again for 24 hours. And if we find that they're pulling out 2 to 3 to 5 to 10 to 20 times more lead, cadmium, or aluminum in their urine as a result of their chelation, I know that I'm helping them remove heavy metals from their body. So at the very least, chelation is a way to remove a toxin from your body. So from our perspective here at the center, if you can remove toxic factors from the body, you're going to improve the functioning of the body. Whether or not it corrects your heart disease, whether or not it corrects other specific diseases, there may be other variables involved. That's why we do not depend upon any one treatment here at the center. We try to look at the whole person, look at all possible causes, use a kind of detective approach to find out what are the underlying contributing factors that's causing this person's illness. But when you do remove these metals, you're eliminating a major inflammatory trigger, you're reducing the oxidation of LDL cholesterol, and as a result, your arteries are aging more slowly. There's been a number of books written about chelation as an anti-aging procedure. I'm going to talk about this a little bit later, but you're really only as old as your arteries are. When your arteries stiffen and become narrowed and you have reduced blood flow and oxygen, reduced nutrients to your cells, that's when the aging process actually accelerates. And if we could keep our arteries young and keep the blood flow and nutrients to our tissues good, that would slow the aging process. You are only as old as your arteries, you and your arteries are stiff. How many people notice as you get older you get a little stiffer? Well, that's what's happening to your arteries, too. Like a stiff garden hose. If you leave your garden hose out all winter, what happens? It becomes stiff due to oxidative cross-linking. In arteries, chelation removes the stiffening agent, heavy metal-induced free radicals. So then your arteries can open up and dilate and allow more blood flow to the deprived organs. So aging equals a loss of circulation. There's an old saying that the healing factor is in the blood. So we find that many, if not the majority of the diseases of aging are associated with the loss of circulation and the increase in inflammation. Loss of circulation, increase in inflammation. Those are two fundamental reasons why people develop diseases. Now, I've got on the back side of that page that I was referring to, the kind of beige colored page, it's entitled A Partial List of Conditions that have been reported to improve from intravenous EDTA chelation. And this is taken from a book. The whole book is online if you would like to read this book. It's called The Case for Intravenous EDTA Chelation Therapy by Dr. Martin Dayton. It's a very well-written little book. And what he's showing here is after 20 million chelation infusions over the last 40 to 50 years, the people who do chelation, like ourselves here at the center, we find that our patients report to us that they're better. And here are some of the things that people say get better. Now, will everyone get better with this? I think it depends upon what other variables are going on. Someone who has heavy metal poisoning could also have a vitamin deficiency. They could also be toxic in some other chemical. They could have a hormone imbalance. So our job here at the center is to try to look at the whole person, correct as many of the correctable problems that we can. And it turns out that heavy metal toxicity is a correctable problem, and that as you remove the toxin from the body, the circulation improves and a number of these conditions start to improve. And I've just listed them here. They're in Dr. Dayton's book. Certainly you would think that how are these all related? Well, the only way they're related is that heavy metals impair cellular functioning. They actually get in and bind up enzyme structures. So when you start to remove heavy metals, the cellular chemistry works better, you start getting increased circulation, and you reduce inflammation in the body. And as a result, some of the common pathways for many diverse illnesses are corrected, and that's why this is such a long list. But this is also one of the reasons why chelation has both been, so many people have taken chelation, is that they're looking for an answer to their chronic illness. By the same token, conventional medicine has tended to look down on chelation because they say, how can one thing do so many good things for a person? And in general, most of conventional medicine focuses on treating specific diseases. Here at the center, we're trying to deal with underlying causes. And when you improve the underlying causes, then you have a greater likelihood of improving the overall functioning of the body. And diseases that were heretofore untreatable start to improve. And that to me is the real exciting part of chelation. Does science support chelation's claims? There's been over 600 studies on chelation, as I mentioned earlier. However, most of them are case reports, case series, and they tend as a rule to show improved blood flow, reductions in symptoms, and an overall safety with chelation. These studies, however, do not meet the scientific criteria as being evidence-based. There's a big move in the practice of medicine now that whatever we're doing with people, we need to have it be evidence-based. So the weaknesses of the chelation research is a lack of control groups, overly broad patient selection, inconsistent measured endpoints, and incomplete follow-up. And part of the reason here I think that I like to address with patients is that a lot of people come in here and say, I'd like for chelation to just fix me, as if chelation or EDTA were some kind of magic bullet. But what we find here at the center, that you're going to get the best results from chelation if you use it as part of a comprehensive lifestyle management program where you're exercising regularly, using whole foods, get off of the tobacco, reduce your stress, use antioxidant supplementation as a way of putting this all together in order to build your health. That, to me, is why I like to refer to chelation as a medical/lifestyle therapy. And for the people that come in thinking they can just keep all of their old bad habits and do a little bit of chelation, I don't think you're going to see as good of a response. So in general, we like to tell people chelation is great, but let's do it as part of a comprehensive program. Now, when you start doing comprehensive lifestyle therapy on people, you've got many variables that enter into the picture, because some people have more discipline than others. Some people have family support that's better than others. Some people have medical conditions that limit their ability to exercise. Or they're dealing with addictions, or they've got other issues that make it difficult for them to really devote themselves fully to the interventions that we would like to have them do. And keeping track of all these variables can be statistically quite difficult. So there's an abundance of anecdotal evidence for the benefits of chelation, probably relating to how well people do the lifestyle part of it. That probably influences things a lot. But what I've learned is, being in the practice of medicine for 30 years, is that medicine is not an exact science. There's an art to medicine, and there's an art to working with people and helping them find their way to better lifestyle behaviors. But I think chelation can be a part of that. But if we want proof about chelation, what we're going to have to do is we're going to have to narrow it down. Let's say, okay, well, let's talk about chelation in heart disease, and let's do a very large controlled study. And I'm going to come back to that because there is a study underway, and I'm going to tell you a little bit about TACT, which is a large national study on chelation. Before I get to that, I want to just cover a few more things. Is chelation safe? Well, as with any medical procedure, adverse side effects are possible, though they tend to be rare. And over the past 40 years, there's been over 1 million patients that have had chelation and more than 20 million treatments altogether. The dosing has become more exact. Some of the early adverse problems with chelation related to the fact that if you give too much EDTA, it pulls out the lead, but the lead has to go through the kidneys, and that load of lead could be actually toxic to the kidneys. So you have to dose the chelation so that it doesn't pull it out too fast. That's why chelation is done over a series of infusions, not just one big infusion all at once. The possible side effects: transient vein irritation, some pain that can be handled with pH adjustment or a little bit of Procaine, headache and shakiness. Most of these patients, their blood sugar is dropping. If you eat before you chelate, you're much less likely to have this happen. The first few times that people chelate, they can be really tired. You are detoxifying the body of heavy metals. That will tend to get better as you continue with your chelation program. The renal stress can be corrected with proper dosage, as I mentioned. Chelation side effects in general tend to diminish after the very first few treatments. People's bodies are getting used to the process now of detoxification. You can expect better circulation, reduced pain. There's an interesting saying that a lot of people begin chelation for their heart, but they continue chelation because of their joints. People who find that they start the chelation because of their coronary artery disease, but they find that, hey, they're less stiff, their joints are feeling better, they keep chelating. Better oxygenation of your cells. Your brain seems to start to work better. When I chelate, I find that I can go home and work the word jumble better. I don't think that's a justification for taking chelation, but I do notice that the brain seems to work better. Better stamina and a greater sense of well-being, greater mental clarity and memory, better vision and hearing, joint pains diminish. In general, when you improve circulation and you get more oxygen and nutrients to your cells, guess what? They're going to work better. Better blood pressure and cholesterol control. Dr. Reardon has a very nice lecture in our library about how lead poisoning is a very common and underdiagnosed cause of high blood pressure, and chelation gets the lead out. So in general, you have the improvement of the diseases of aging. Is chelation costly? Well, it's a little bit costly, but if you look at the cost of comparing it to nitroglycerin versus coronary artery bypass surgery, it's all relative. It's all relative. You can just, if you've got chest pain, you can take nitroglycerin. It doesn't cost very much. It relieves the symptoms, but it's not helping you correct the underlying cause of the disease. Bypass surgery will help you bypass where the blockage is. It's very expensive. You're treating a couple inches of your arterial pathways, but you're not really dealing with the other arteries in your body. And so, and the other big problem with bypass surgery is that there's a tendency for restenosis to occur. So this is considered a major problem in conventional cardiology. Chelation is an office procedure. It treats more than 100,000 miles of arterial pathways. costs about $100 per treatment. That varies depending upon what's added to your chelation, and about $2,000 for the workup. Usually costs less than the deductible for having bypass surgery. The limitations of bypass are very expensive. Oftentimes there's no big difference in long-term survival or quality of life study, and bypass does not address the underlying disease process. Oftentimes second operations are needed. Add 5% to the probability for each year of post-bypass. Some people worry that chelation is an illegal procedure, that you really shouldn't do it, that it's not FDA approved, and that somehow you're skirting the law or doing something behind your doctor's back. EDTA is a completely legal drug. It does have FDA approval for treating lead poisoning, and a licensed physician is free to utilize any therapy of acceptable risk which, in his or her professional judgment, is of potential benefit to their patient, even if claims for treatment are yet FDA approved. Where the FDA comes down, so to say, against chelation is that when you make the claim that chelation is a treatment for heart disease, you don't have that double-blind, placebo-controlled study there to back you up. You have a lot of these case series. You have a lot of patient experience. You have your own experience working with patients. And so what we here at the center tell our patients is that if you can remove the heavy metals, you have the ability of improving arterial blood flow. And that can reduce your risk of other problems and at least improve your functioning, if nothing else. Medical and most insurance companies generally do not cover chelation because of this lack of double-blind studies. Medical review committees are staffed by physicians who favor drug and surgical therapy for atherosclerosis in spite of the higher costs. There have been patients that have resorted to legal action to collect their insurance benefits, but it's a tough road to go. And so a lot of patients just pay the money and get the chelation done, and then they enjoy the benefits of the chelation procedure. And they feel like it's very much worth the money that they spent for it. Are 1 million people wrong? 1 million people have undergone chelation. They have done so in spite of medical condemnation of chelation. They have paid for chelation out of their own pockets because they have experienced results. They know when they're feeling better. Or, are they wrong? Or like Dr. Semmelweis, all of you know the story of Dr. Semmelweis, the Austrian physician who had the audacity of accusing other doctors. He did a research study in Vienna in the 1800s where he had the doctors wash their hands before they delivered the baby in order to cut down on the number of puerperal infections, the mothers that would become feverish after the baby was delivered. There was a very high death rate. He was able to dramatically lower that death rate by having the doctors wash their hands. But the problem with that is that it implied that the doctors were causing the infections in these women, which they were, but they didn't have the germ theory at that point. They didn't know that this was being transmitted by germs, and so he was kicked out of his medical society. And now we know that good hand washing and sterile practice is just logical. Every hospital does it. So Dr. Semmelweis made the mistake of being ahead of his time. But what we really need is better science. Can science help us gain this understanding of the actual value of chelation? And so this is where I'm going to talk to you today about an opportunity, for those of you who have been interested in chelation but maybe have been holding back because of the cost or just didn't know that it was available. There is now underway here in the United States a large-scale, 5-year, randomized, double-blind, placebo-controlled trial to assess chelation therapy. So here's the left brain coming in in spades. It's going to seek to enroll 1,950 subjects, sponsored by the NIH, including the National Institute for Complementary and Alternative Medicine and the National Heart, Blood, and Lung Institute, in conjunction with the Mount Sinai Hospital of Miami and Duke University. So this is a very, very well established, it's like a $30 million study that's being done nationwide. And so we've applied to be one of the over 120 official test sites for this study. And what I have in your packet is a green sheet that will list it's an opportunity for you to, if you're just interested in participating, you're not signing up for it, but if you're interested in it, fill this out. So our mission here at the center is to educate and treat those who have not gotten results elsewhere. But we are also very responsible for doing the research that's necessary to provide the scientific underpinnings for what we do. So we're very excited to be a part of TACT, which will help us legitimize what we have observed to be a very effective treatment for our patients. Why is this study being conducted? Now, this is some of the literature that comes out of TACT. Many people are considering using chelation therapy because of the belief that it may treat heart disease. Despite clinically significant case studies, this has not been scientifically proven. Controlled studies did not, there has been a few controlled studies, but they were very small, and the evidence that they provided was not conclusive that chelation should not be tried. So right now there exists an interesting kind of balance going on in the world. There's all this public support and empirical research showing that chelation is very helpful. But what we're lacking is the left-brain scientific double-blind placebo-controlled study that definitively says it really is helpful. So on that basis, the NIH has authorized this relatively large study to be done in order to answer this question, this trial to assess chelation therapy. Is chelation therapy safe? Is it effective in reducing the incidence of clinical cardiovascular events? Does it improve quality of life and reduce healthcare costs? These are actual questions that the study will answer. If you were interested in being in this study, what would you be asked to do? You should discuss your participation with your regular doctor. You should know that the participation will last up to 5 years. And during that time, it will be important that you continue any standard heart disease treatment. So this is not being used as a substitute for what you are already doing with your heart disease. The treatment that you will receive, you will be randomly assigned to receive one of several different treatment combinations. Randomly assigning people to treatment groups will help ensure that the treatments can be compared objectively. So either, if you let's say you decide to be a part of this study, you would be getting your IV chelation, but neither you nor the nurse nor I or the center would know which kind of treatment you were getting. The solutions are actually mailed to the treatment site by the Mount Sinai Hospital. They're already pre-prepared. We have to send in your weight, your creatinine level, all the information that's needed in order to properly calculate an EDTA dose. And then what we get is a solution for you. You receive a 3-hour infusion. As I said, none of us here would know whether it was the active chelation or the placebo solution. Everyone will get at least the low-dose vitamin pills. When they say placebo pills, everyone will get at least low-dose multivitamin pills, but the chelation group will also be put on high-dose vitamins because there's a question as to whether or not the EDTA chelation by itself would do the job. Most chelation doctors know that you don't want to give chelation alone. You want to give it with a very good multivitamin supplement. So they're going to provide that. So, and everyone will at least get the low-dose vitamins. Your chelation appointments will be once a week for 30 weeks, and then 10 more infusions every 2 weeks, somewhere between 2 weeks and 2 months apart. So you'll have a total of 40 chelation infusions or placebo infusions. Each treatment will take about 3 hours. Participation is your choice. The study team will work with you to schedule your visits at a time that works best for you. You can leave the study at any time. No one's going to, handcuff you to the chair. Why would you want to participate in a study like this? Well, for those of you that have an interest in what we're doing here at the center, we really want to show that there is evidence that chelation works. But in order to do that in a credible way, it has to be a double-blind, placebo-controlled study. So we're very willing to enter into this, and for those of you that have a scientific spirit and have heart disease, you can enter into it too, even though you wouldn't know for certain if you were getting the placebo or the active treatment. So you'll be joining a nationwide effort to learn whether chelation therapy works. One of the advantages, either way, is that the people who join the study will be seen by a doctor here every 3 months while you're enrolled in the study to see how you're doing. So you get very close monitoring while you're in the study. Are there risks or side effects? It's been used for a long time and has been found to be safe when we treat lead poisoning. We found that there's a very low occurrence of side effects. As they state here, the safety for EDTA treatment of heart disease has not been established. The thing that we've noticed over 25 years of using chelation is about the worst thing people can expect is a little bit of a burning sensation when they very first start EDTA. Some people feel a little bit of fever, headache, and nausea. Those are the early detoxification symptoms that I mentioned. There are very rare occasions where people will get a sudden drop in their blood pressure. That's why we do chelation at a medical facility. Abnormally low calcium levels can occur. This can be monitored. Permanent kidney damage is possible, but if you've done the pre-testing and adjusted dosage according to your creatinine level, this is very unlikely to occur. Bone marrow depression, another very, very rare side effect. Reversible injury to kidneys, although infrequent, has been reported. Once again, if you get the right calculation of the dose, that will minimize that risk. The fact that it's being administered by trained health personnel is a very important part of the safety of chelation. Because chelation removes vitamins and minerals from the body, it's important for you to take the vitamin supplements that's going to be supplied to you by the study. It is also important that you continue to take your standard heart disease treatment. So this is not going to be a substitute for whatever else you're already doing. If you decide to take part in the study, there is no cost. And so instead of incurring that $3,000 cost or even more to do a standard course of therapy, you will have no cost. So the advantage is you have the possibility of receiving the active component of chelation, and you'll get the monitoring and the vitamins and the satisfaction that you are making a contribution to the science of chelation and the care of heart disease. You should continue to see your regular doctor, maintain your health insurance to cover all medical care not included in the study. So we've applied to be a site for this. I will be the principal investigator. I've been certified in chelation now for probably about 15 years. Been involved in, I've had 50 chelations myself. I've found it to be very beneficial. But see, in a sense, that doesn't matter. The thing that matters is that we're going to provide really high-quality nursing care, and we have the experience of having done thousands and thousands of chelations here at the center. So that's one of the reasons why I think we're a very good site to offer this. So if you're interested in participating, even if you don't know for sure, but you have like an interest in it, go ahead and put your name and address and information on the back here and hand that to Jan or myself when you're leaving, and we can talk about it more. It's not a commitment. It's just saying, hey, I'm kind of interested in what you're saying. Once we have formal acceptance to be one of the official tax sites, we will contact you. And there's a couple things that you need to know about eligibility. It's on the green sheet, but I'm just going to cover it real quickly here. In order to be eligible, you have to be 50 years or older, male or female. And in order to document that you have heart disease, in order to be in the study, you have to have had a heart attack at least 6 weeks prior to the start of the study. That way, if there's documentation from a hospitalization that you've had EKG damage or the enzymes show that you've actually had heart damage, that way the people that are coming into the study, we know that they've got heart disease if you've had a heart attack. So I'm not recommending that you go out and have a heart attack in order to be in the study, but if you have had a heart attack, you are eligible to be in this study. Who's not eligible? Anyone that's had chelation therapy within 5 years prior to the start of the study. That would confuse the whole results. If you happen to know you were allergic to EDTA or Procaine, for instance, then you wouldn't want to be in the study. If you've had coronary or carotid revascularization procedures within 6 months prior to the study, or you're scheduled to have one, then that would not make you eligible for the study. Cigarette smoking is a big variable, so one of the criteria they've set up is that if you have a history of cigarette smoking within 3 months prior to the start of the study, that would knock you out of eligibility. If you're over 50 and you are of childbearing potential, I'm sorry, you can't be in the study. That's the interesting lady, though, that has that, I guess. History of liver disease, or if you have some kind of a life-threatening, if you have a advanced cancer diagnosis or something like that, they are recommending that you not come into the study. So my conclusions are that chelation is a medical lifestyle therapy that improves your circulation. We have found it here at the center to be very safe under medical supervision. We think it's extremely cost-effective. If it can help you prevent future problems, if it can help you treat the conditions that you're dealing with, that's going to be worth your while. And the costs of having a serious illness, you can't put a dollar figure on that. So if that can help you prevent serious problems, it's well worth it. There's many side benefits to chelation. The people who do chelation have reports of better hearing, better memory, a lot of things that improves your overall quality of life. And the interesting thing about chelation, if it were really so bad, how come has it survived for 50 years as an alternative treatment for vascular disease? To me, that means there's something to it, but I'm all in favor of a good left brain study that proves once and for all that it really does do the job. So you have two choices. You can remove heavy metals and improve your arterial function and circulation by signing up for chelation here at the center if you're interested, but you're not a candidate for the study. You're sure still welcome to come on as a new patient, and we will work you up. And we do chelation here at the center just about every day. You can also help to advance the medical science of chelation therapy if you are eligible to be a participant in TACT and are interested in actually being a participant. We would sure like for you to go ahead and sign up. So, any questions at all on this? This is kind of the end of my presentation. Yes, sir.
Parts per million of the EDTA do you administer at a time?
I don't know how many parts per million it is. There's a formula that we use to calculate the number of grams of EDTA per body weight per level of creatinine or kidney function, renal function. So it's based upon those variables, and so it's different for each person.
So when you get a script of it, or when you buy it from whoever the supplier is, they have to deliver it in some kind of parts per million. That would have to be.
Yeah, we could figure that out for you. I just don't know off the hand what the parts per million is, but it's a standard vial of EDTA that we get. Marcia, do you happen to know what parts per million it is? No, we'd have to look on the vial, but it's a standard amount.
Dr. Ron, I know at the laboratory here we do the pre and the post urine, so they can measure the amount of heavy metals that have come out from chelation. Is that part of this? Do you know?
Not to my knowledge.
Okay.
Again, from the conventional perspective, that they don't really care that much about it. They want to find out if you follow the protocol, does it reduce your likelihood of having a heart attack? So they're not. I mean, yes, they want to have you remove heavy metals, but they're not concerned about how much. Here at the center, after every 10th chelation, we have you do a 24-hour post-urine collection so that we can see how much of the heavy metals are coming out after that many chelations. Chelation? Oh, I'm sorry, over here, yes.
How can you tell if your arteries are stiff enough to benefit from chelation?
Do you have trouble getting out of bed in the morning?
No.
I would say, I don't know if there's anything specific that I can tell you that, people who have high blood pressure, that's a stiffening of the arteries. People who have decreased vision or hearing or different aging functions, that can be representations of stiffening of arteries. But we don't have a specific stiff artery measurement that we can do. A lot of times, if you have one of the conditions that's listed in this list of conditions, that may be a reason to at least have the diagnostic part of the chelation done. When people come in telling us they're interested in doing chelation, our workup includes this 24-hour urine collection, then we do a standard chelation, and we have them collect another 24-hour urine to see how much heavy metals are coming out. And if we see that there's no change after chelation as compared to before, I'll sometimes tell people that I'm not sure chelation is really going to be a benefit to them.
So poor memory might be old age.
Yeah, there's a lot of things. Poor memory means your brain's just not working as well as it could. It could be due to inflammation, but it could also be due to the small blood vessel disease not carrying adequate amounts of blood to your brain. And so,
I had poor memory at age 10. It's just gotten steadily worse.
yeah, I know the feeling.
Yeah, how about the oral chelation? Is it effective?
Oral chelation. As I mentioned, oral chelation is what you're doing is you're depending upon the EDTA that you're taking by mouth to sequester heavy metals that have been secreted by your bile, by your liver in the bile, or whatever's in your food, and then that prevents those heavy metals from being absorbed through the gastrointestinal lining. There are many reports that oral chelation works. Once again, it's probably suffering from the same lack of double-blind, placebo-controlled evidence that IV chelation deals with as well. But from a report perspective, a number of patients have benefited from oral chelation.
Do you have a recommendation of what type of oral chelation? You mentioned earlier you did.
Well, in general, I tell people with oral chelation, you're never going to get as good a chelation as if you get it IV. But there are some people, because of cost or distance, oral chelation, I think, is a good second choice. And so, yes, we do carry a type of oral chelation up front that was formulated by Dr. Gary Gordon, who's one of the original founders of chelation in this country. And he's got evidence at his website that it is beneficial, and that's the one we carry. But again, I tend to suggest that people, if they can at all do it, to do IV chelation as the primary route of chelation. That's where the most experience has been gained. Oral chelation is kind of a new thing, and there's also other types of chelations that have become available. There is the patch chelation and the rectal suppository chelation. Again, those are even less tested than the IV or the oral.
If you go the oral chelation route, do you need the blood workup?
If you go the oral chelation route, do you need the blood workup? No, you don't need to. But and you're not going to have the same level of risk because the EDTA is not going to be absorbed into your bloodstream, and it's not going to affect your kidneys to any significant degree. But then again, you may not know how much metals you're dealing with, and by doing the diagnostic chelation, it gives you a better idea of just what kind of a burden of heavy metal poisoning that your body has. Yes?
On the high-dose vitamins, are vitamins both in the infusion and you're given pills? And altogether, how high a dose are we talking about? Of what?
Well, there's a standard set of nutrients that are part of a traditional chelation. It includes vitamin C, it includes magnesium, B6, and those are the main IV vitamins. The oral vitamin is a multivitamin that has antioxidants in it, but it has the minerals that will replace the good minerals that get pulled out by IV chelation. So you really need both.
Okay, some really good questions.
All right. Well, thank you very much, and I hope those of you, if you think you might be interested in being in the study and you're not even sure, just at least put your name down so that we can contact you and see where you stand down the road here. Probably we'll know in the next week or two for sure when we'll be starting the study here at the center. So thank you very much for coming and listening.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.